On Thursday, about 10,000 new tests were reported in the Department of Public Health's daily report. That brings our total number of tests conducted to over 560,000 tests. Around 8% of the tests reported yesterday came back positive. That's pretty consistent with where we've been for the past week or 10 days. And that's obviously a big reduction from where we were several weeks ago and several months ago. As of yesterday, there were 2,112 patients who were hospitalized due to COVID-19. Public health data, I think as everybody knows, is the primary indicator of how COVID-19 is impacting our communities, and it will continue to determine how and when we reopen the economy. Our hope is that as time goes on and we slowly and carefully reopen different sectors, the key metrics like the percent of positive cases, hospitalizations, ICU bed capacity keep trending in the right direction as we expand our testing capacity statewide. But how quickly that happens, obviously, is in many ways all up to us, government, employers, individuals, communities. And just because we're gradually reopening the economy doesn't mean that we should let up on all those key practices that we can all do on a daily basis and had so much to do with getting us to where we are now. We all need to remember that our roles in this, to cover our face if we can't stay distant, to wash our hands, clean surfaces, disinfect, and every time you can, you need to be vigilant with respect to symptoms for you or someone else. Stay home when you can, and especially if you don't feel well, help protect yourself and others. The more we all do with this, the more likely we are to continue to move forward and back to something more like what we used to call normal. With respect to our reopening plan, on May 18th, I think most people know that we introduced the Commonwealth's plan to gradually reopen our economy using a phased-in approach. And as we've said many times, any decision to reopen our economy hinges on public health data and trends that we observe for key metrics of COVID-19 and its impact here in the Commonwealth. To monitor key health metrics like new cases and hospitalizations and positive tests, we put together a 6-part dashboard to rate our progress using green, yellow, and red markers. When we announced our plan, we also made clear that each phase would last at least 3 weeks before we move forward. This time frame allows our public health officials the opportunity to see how COVID-19 reacts to more and more people being out and about and moving around. The research suggests that it takes up to 2 weeks for the virus to manifest itself in someone, so we planned for the 2-week incubation period plus a week to see any trends that might emerge to determine if there was in fact a significant increase in infections or hospitalizations. And in the meantime, our job, call that government, business, and individuals, is to keep doing the things that we all know can slow the spread of the virus and help us gradually move back to work. Until there's a medical breakthrough, this is the only and best way we have to beat the virus and to get our businesses and our routines back to something like normal. And thanks in large part to everybody's cooperation, we've made real progress in fighting COVID. Since the middle of April, Massachusetts' 7-day average for positive test rates of COVID-19 has gone down by about 70%. And that's at the same time we've dramatically increased our testing here in Massachusetts. The number of hospitals statewide that are operating in surge capacity is down by 60%. And the 3-day average of COVID-19 patients in hospital care generally is down by about 40%. But we need to keep trending in that direction to move forward to the next phase, and we really can't take 1 step forward and then take 2 steps back. Our public health experts will continue to carefully monitor the data between the 1st and the 6th of June in order to determine when exactly phase 2 should start. And based on that analysis, on June 6th, we'll announce the plan with respect to when phase 2 can begin. And as we said from the start, the public health numbers will guide the process. It's the only way we know, and it's the best way we know, to get back to work and continue to fight the virus. In a few minutes, the Lieutenant Governor will detail some of the new guidance that's been issued for restaurants and lodging that applies to phase 2. This information will allow businesses to prepare to open when the public health data indicates that it's time to move on. On Monday, I'll also be issuing an executive order that will designate a more detailed list of sectors that fall into each phase. This list was offered at a high level on May 18th, and will provide much more clarity for the public and for businesses next week. Monday's order will also allow Phase 2 businesses to begin to bring back some employees to prepare for reopening beginning Monday in the anticipation of the start of Phase 2, but that will be, of course, without customers. It's important to note that businesses must follow the workplace safety guidelines if they re-enter their establishments to get ready to reopen, and we urge employers only to bring back those employees that they need to prepare to reopen. We've also had very positive conversations with our professional sports teams, the Celtics, the Bruins, the Patriots, the Red Sox, and the Revolution. And this order will also allow professional sports teams to begin practicing at their facilities in compliance with the health and safety rules that all the leagues are developing. Facilities are still closed to the public at this time. I know we still aren't to the point where we'll have our pro sports teams back playing anything yet. The leagues are obviously working hard to host games again, and I think we all hope that at some point opening practice facilities will help make that happen a little sooner. You know, there's just so many times you can actually watch the Patriots beat the Falcons, or the Celtics beat the Lakers, or the Bruins beat the Canucks, or the Red Sox beat the Yankees, or the Cardinals, or the Angels. At some point, it's got to be live. And I think for all of us, live sports, and especially pro sports, would be a great thing to see again, because not only will it be a significant milestone for those of us who are fans, but it will also send a big signal that we've continued to do all the things that we need to do to contain and control the virus and keep it in check. This reopening, of course, will also be gradual and requires a lot of patience for everyone. And as I've said before, this virus answers to no one and isn't playing by any set of rules. There was a really interesting story in the Washington Post. There's a columnist there who writes a column called Health 202. 202 obviously is the Washington area code, and all she writes about is healthcare issues. And she recently wrote a piece where she talked about the fact that with so much of the data associated with coronavirus being murky, it puts public health officials in sort of an awkward spot. And as I read the story, my conclusion was it didn't just put us in an awkward spot, it put practically everybody in an awkward spot, because it is one of these things where as more and more information becomes available, what was once true suddenly becomes less true, and what was once less true becomes more true. And I think one of the great challenges we will all have as we move forward on this is continuing to deal with the constant arrival of new information, which has implications for the decisions we make and how we respond to this. But the one thing I can tell you is it is contagious. It's very harmful, obviously, to vulnerable populations, to our elderly, and it thrives in environments where people are in close contact. There's no dispute about any of that. And the impact on our socialization and our economy to stop the virus as a result of those issues has been incredibly difficult. And this is obviously the time of year when everybody looks forward to getting outside, to celebrating graduations, weddings, and new beginnings. And while some things will still need to wait, we are certainly seeing positive momentum in a number of areas and hope we all do the things we need to do to continue to move that forward. People are starting to get back to work. Outdoor and recreational activities are starting to come back. We're making progress. Thanks to everyone doing their jobs now more than ever, and we need to keep doing what works to kill and slow the virus. With that, I'd like to welcome the Lieutenant Governor to the podium to talk a little bit about Phase 2.
Thank you, Governor, and good afternoon. As the Governor noted, we are in the process of moving forward with our plan to reopen the Commonwealth. This plan was put together with input from a variety of associations, businesses, and Massachusetts residents. To reiterate what the Governor said, public health data and trends between June 1st and June 6th will drive when Phase 2 is able to begin. To better prepare Phase 2 businesses for the reopening, today we are issuing new guidance for restaurants and lodging. These workplace-specific safety standards are organized around 4 distinct categories covering social distancing, hygiene protocols, staffing and operations, and cleaning and disinfecting. When we announced our reopening plan on May 18th, we established a work group of industry representatives and municipal leaders to help us determine industry-specific protocols for both restaurants and for lodging. I want to thank the members for their valuable input as they literally understand the operations and provided us some great insight and ability to prepare these specific protocols. Today, we are issuing these workplace safety standards in advance of Phase 2 to give lodging facilities and restaurants time to prepare their operations, to get ready, and to do that in adherence to the general workplace safety standards that we previously issued. For restaurants, outdoor dining will begin at the start of Phase 2. We're working with our partners in the legislature on streamlining the process for local permitting for outdoor dining. Indoor dining will begin later within Phase 2, subject to the public health data. This guidance will be posted on mass.gov on our Reopening Massachusetts website. The restaurant guidance will include protocols for physical space and social distancing, and here are a few highlights. Tables must be positioned 6 feet apart. The maximum party size will be 6 people. Even when indoor seating is permitted, use of outdoor space will be encouraged for all restaurants to increase ventilation and better social distancing. Customers may not be seated at bars, but bar areas may be reconstituted for table seating. Today's guidance for restaurants will also include specific hygiene protocols to keep spaces clean. For example, protocols to keep items like utensils and menus cleaner through single-use or strict sanitization guidelines. Reservations or call-ahead seating is recommended. Contactless payment, mobile ordering, or text on arrival for seating will also be encouraged. Restaurants should also provide training to workers on up-to-date safety information and precautions, including hygiene and other measures aimed at reducing disease transmission. Workers, of course, should not show up for work if they feel sick. And finally, restaurants will be expected to follow cleaning and disinfecting guidelines in accordance with CDC guidance. This includes closing an establishment temporarily if there is a case of COVID-19 in the establishment. We also provided guidance for lodging. Hotels, motels, and other lodging businesses will be allowed to expand their operations in Phase 2. Lodging safety standards apply to all forms of lodging, and that includes hotels, motels, inns, bed and breakfast, short-term residential rentals, including those arranged through online hosting platforms such as Airbnb and VRBO. Event spaces like ballrooms and meeting rooms are to remain closed. On-site restaurants, pools, gyms, spas, golf courses, and other amenities at lodging sites may operate only as these categories are authorized to operate in accordance with our phased reopening plan. And lodging operators must inform guests of the Commonwealth's policy urging travelers to self-quarantine for 14 days when arriving from out of state. The lodging guidance includes social distancing protocols, cleaning and hygiene protocols, and guidance to limit and streamline staffing operations and keep people spread out during their shifts. Finally, this guidance contains specific instructions on enhanced sanitization protocols between guest visits. And after departures, lodging establishments are asking to clean and sanitize all surfaces, wash linens and bedspreads, and may consider leaving a room vacant for 24 hours when possible between guests for deep cleaning. And in the event of a positive case of COVID-19, the room used by that guest may only be returned to service after undergoing an enhanced sanitization protocol in accordance with CDC guidelines. These full guidelines will be posted, as the Governor stated today, at the Massachusetts State Coronavirus website, mass.gov/COVID-19. For additional information, establishments can access additional worker safety guidelines and resources at the OSHA COVID-19 webpage or the CDC. In closing, I just want to acknowledge the sacrifices that so many people in the restaurant and lodging industries have made since the start of the fight against COVID-19. Your restaurants and your businesses make up the fabric of our Commonwealth and define our economy and our communities. As we move forward in reopening our economy, we understand the importance of balancing public health and economic health, and we need to do everything we can to support both. Together with state and local governments, we balance the shared goals of maintaining both public safety as well as getting our economy back up and running. And as we navigate these next phases in our fight against COVID-19, we will continue to work with our industry partners to do what's best for local main streets and downtowns. I'm confident that the restaurant and lodging owners, managers, servers, bartenders, and staff, and the many others who make up these industries will get back to work, will reopen their doors and their places to the residents across our Commonwealth, and be able to offer the things from your places that people know and love so much in their communities, and will do so as safely and as quickly as possible. Thank you. Back to the governor.
Questions?
Explain, I know you had said a couple of weeks ago you wanted indoor and outdoor dining. I think that was the goal. Why did you decide to do it this way, outdoor first and then indoor? You would conceivably think that maybe restaurants could space tables 6 feet apart in some restaurants.
I think part of it had to do with the guidance we got from the public health folks that working with a new model, if you could do it outdoors, the ventilation obviously outdoors is a lot better than the ventilation indoors. It would give people a chance to figure out how to work between the tables with respect to the degree of the spacing. And we also got a lot of positive feedback from our colleagues in other states that started with outdoor first as a mechanism to create a sort of a walk back into the process of operating indoors as well. And it is spring.
I'm sorry?
And it is spring. Yeah.
Governor, a question I asked Mayor Walsh yesterday after the announcement on the marathon was what happens, what does he suspect happens if he has Charles? He said that's a state decision. Any thought being put into that at this point?
We've had early preliminary conversations with those folks, but nothing more. And I don't believe there's an immediate deadline with respect to when that decision has to be made. And obviously, the other folks who are particularly interested in this, in addition to the participants and the sponsors, is the City of Cambridge, who we also need to spend some time with. Yeah.
3 weeks ago today, golf courses were allowed to open, and they were with severe restrictions. And as of today, Massachusetts is the last state to open practice ranges and driving ranges. Are you going to give any consideration to open those right away?
Those open, I believe, under this report in Phase 2.
Now, the state has spent a lot of time telling private businesses how to open properly and safely. Yet the state owns 2 golf courses, Martin and O.J. Martin. They're closed for the last 3 weeks and indefinitely. Why is that? Why can't they open safely given everybody else has been open since then?
I think we're pursuing what I would call an abundance of caution strategy on a number of these issues, and that happens to be one of them.
Well, a golf pro, in a golf shop wants to know why you can go into a Home Depot where there are hundreds of people under one roof and you can't allow 1 or 2 individuals into a golf shop to purchase golf merchandise. Why is that?
I think from our point of view, the best thing we can do is recognize that certain kinds of industries need to be open on an essential basis because of the goods that they sell. Others that don't meet that essential category are typically opening later. And that's pretty much the way it's worked in every state in the country and every country in the world. And I'm okay with following that.
Governor, could you speak to the, we talked to a couple restaurant owners, and they've expressed concern, just people are afraid to kind of go into a restaurant. Can you talk about that? I mean, they said it doesn't matter, they can open up, but they're a little concerned about the public having the confidence to go out and spend an hour and a half at a restaurant.
Well, one of the reasons for pursuing an outdoor strategy to begin with is that's an easier and a simpler way for somebody to reintroduce themselves to dining. And I think in some ways, based on the conversations I've had with some of my fellow governors, that has been in many ways one of the reasons for going outdoor first, is it creates a possibility for people in a slightly different kind of setting to sort of return to the restaurant or just return to eating out generally.
And can you just talk a little bit about what this will look like? People will go in with masks on, but in order to eat, off your mask in order to have.
I'm going to let the Lieutenant Governor talk about that one.
It goes back to the balance, right, between the public health and all the amazing work that the healthcare system has done in this Commonwealth to get us to this point, and to balance that with the economic health that we are so concerned about. And one of the things that we want to make sure people feel is comfortable and confident as a worker, as well as a patron and a customer. And that's why we've spent so much time through the reopening advisory board process to develop these industry-specific protocols, which literally are the how-to make a workplace in an establishment safer. And when it comes to distancing and hygiene and protocols for the workforce, all of that is laid out. And to do it in a way that's easier for the owner of this establishment to comply. So having a checklist, literally, with these are the things you need to do in order to make your workplace safer, and then to have a poster and post that in a place so that the public and the workforce knows you've taken it seriously and that this place is safe. That, for instance, between seatings, there will be a sanitization process. That tables won't be preset with utensils and plates. That condiments won't be on the table when you get there. That both workers, as they move around the restaurant, have to wear a face covering. And that patrons wear their face covering coming into the restaurant and then moving about the restaurant if they need to use the facility. But while seated, they don't need to wear their face covering, and they can enjoy the experience of dining out, which is what we're trying to achieve in this process. And as we have done since the beginning of this process, we've introduced some activities, we've observed how it's going, and then it allows us to continue to move forward and add more, which is the sequencing that other states have included in their reopening plan around starting with outdoor and then moving to include indoor. I have to say, some states have been very creative, and communities around how to organize outdoor dining. And that is something that Secretary Keneally and I and the work group are very interested in, developing the best practices and strategies with municipal leaders to come up with exciting and new ways to have a dining experience outdoors. And as the governor said, the weather is getting better, so we can see more of those opportunities throughout our Commonwealth.
Has there been any discussion about open container laws at all, and maybe relaxing some restrictions? I know,
Right.
for example, we take my Chamber of Commerce was talking about shutting down the streets and setting up tables outside for outdoor dining. Has that been discussed at all?
Yes, the issue about how to consume on-premises, how to change licenses to include on-premises alcohol in a restaurant that doesn't have outdoor capacity, and that kind of alcohol service is all under consideration. We're working closely with the legislature in addressing these and to try to give the restaurant operators some options and some different tools to work with during this time.
Following up on that, there's many restaurants in Massachusetts that just aren't set up for outdoor dining. If they want to take advantage of this, you go a little bit deeper into what you're doing to maybe streamline, whether it's permitting or allowing them to make the changes needed to comply with the law, but also to...
Yes, typically it is a multi-step process, and a time-consuming process. Could take up to 6 weeks to allow for this on-premises consumption that might not exist for a restaurant today. That is the very process that, working with the legislature, can be collapsed into a streamlined, more efficient approval by local officials, and we're working with them to educate them about how to do that so that these decisions can be made more efficiently and help restaurants that don't have outdoor capacity gain the permit and be able to establish that. We're also working with the Mass Department of Transportation through our Complete Streets program to expand opportunities on sidewalks and roadways. And I had a lot of conversations with managers and mayors who are looking at outdoor public areas to work with their businesses and restaurant owners to be creative about events that could create dining experiences to get people back and interested in dining outside of their homes.
I would fully expect that you're going to see, if we can get this worked out with the legislature, you're going to see a lot of parking lots and other kind of open spaces convert, which I think would be perfectly appropriate.
Can local boards of health, are they prepared to enforce, it seems like every phase, every round of new opening, it's more and more we're going to do something enforcement mechanism locally. What are you doing to back them up? Can they do this? Can they control restaurants?
Well, first of all, they do have help on this stuff in particular. There are a number of players in most local communities beyond the Board of Health who have something to say about issues associated with restaurants. The second thing is we have twice put tranches of new money into the local boards of health over the course of the past several months. And part of the reason we set up a collaborative tracing program working with Partners in Health and with our community health centers and with the local boards was so if the local boards wanted to be able to turf some of this stuff to another entity to support them, they'd still have access to all the data and all the information. They could agree to do that.
So as far as contact tracing, are restaurant reservations going to be similar to what we're seeing in salons and barber shops? We're taking down names, taking down information?
I believe so, yeah. Yeah.
So your restaurant reservation will kind of be a public record in that way?
Well, if it's a private entity, I don't know if I would call it a public record, but
But
yeah.
subject to the contact tracing.
It's encouraged, yeah.
Governor, did I understand correctly, someone like going to an Airbnb on a date would have to self-quarantine for 14 days?
So in phase two, lodging, as I described, is able to open for hotel service within the room service, and they can begin taking reservations. The hotel operator or manager, the staff, must tell the person who's making the reservation that we have a policy in Massachusetts that urges a 14-day quarantine. It is up to the individual customer or consumer to self-comply.
Last question.
Governor, I heard again today, the Lieutenant Governor talking about 6 feet of social distance. The other day you were at a T station wanting to read their WHO rules on
Yep.
you thought about that? What do you think is the right distance?
I think it depends upon the circumstances and the situation. I think if you're going to be in a place for a long time, indoors, I think the 6 feet issue is the right way to go. Look, if the WHO thinks 3 feet on public transportation, if everybody's wearing a mask and doing everything else that they're looking for, I'm not going to argue with them.
CDC says 6 feet.
Welcome to coronavirus, where honestly, I mean, one of the greatest challenges we all face as public officials is the changing nature of what people believe to be true, what people believe what works best, and how to frame that up into a set of policies on a playing field where knowledge is constantly changing and moving. I mean, I brought up that Washington Post article because I happen to agree with it. One of the biggest challenges we've had since this whole thing began is the ability to make decisions based on what people, the CDC, World Health Organization, whoever else the smart folks are, about what is. And, I'll go all the way back to one of the first things we were told was that there's a couple of days of gestation for the virus, right, before people become symptomatic. So a lot of organizations, some with a big push from us, and this wasn't just true here in Massachusetts, this was true all over the country, were encouraged to test the temperatures of their workers before they could go to work. And we did that with our correctional officers. A lot of the healthcare folks did it. Businesses did it. A lot of people did that. And it was only, weeks and in some cases months later that people started to say, some of these folks, never become symptomatic. Maybe 5 or 10%. And then that number moved up to maybe it's 20%. And now people talk about as much as 35%. And there was a recent series of tests they did of a big group. It was even bigger than our nursing home, where literally 100% of the people who had tested positive never had symptoms at all. And that is in many ways what makes this virus so difficult. My view on the whole issue around issuing a mask, part of the reason we went from an advisory on that to an order was because the percentage associated with this idea of pure asymptomatic carrying of the virus just kept going up and up and up. And once it got to the point where it was more than 30%, my view, and I think the view of a lot of others, became you should be wearing that mask as much to protect others from you as you are wearing it to protect you from others. And if two people are wearing, and then there was a big debate about how effective masks were. And at this point, people seem to have settled on this idea that depending upon the nature of the mask and all the rest, it's somewhere between 50 and 80% effective if both people are wearing it at eliminating transmission. Okay? And I think the challenge that we have is we have to take all this information from a whole variety of different sources and figure out where we're going to try and land to do the best we can to represent the people of the Commonwealth and keep people safe. And I am hoping that over time, this big funnel of points of view will shrink to the point where we have a much narrower frame in which people view a lot of this stuff. I'm hoping the same thing happens with serology testing. I'm hoping the same thing happens with a number of other issues on this. But one of the great challenges we all face, which is why we constantly talk about face coverings and hand washing and hand sanitizer and disinfectant and all the rest, is because those tools, and distance, those tools are enormously effective, sort of irrespective of some of these other issues. Testing. If I go Google, how many tests is enough? I can get a spread on that that's this big, right, with regard to how much testing you need to do to be effective with your test strategy. We have to decide. Now, we've landed on a testing strategy here in Massachusetts that will make us one of the largest per capita testers in the world, if not the largest, okay? And is that, South Korea is not going to test that much. I mean, there are a lot of places that aren't going to test at the rate we're going to test at. That's the rate we believe we need to test at based on our conversations with the experts here about sort of our demographics, our population density, and a whole bunch of other things. But I think in some ways, figuring this out and creating a framework we can move forward in Massachusetts is part of what creates the frustration that I hear and that we all hear from the you're not going fast enough and you're going too fast.
Going back to the...
Because a lot of folks will read a lot of the same information we read and land on one side of it or the other. And I'm completely sympathetic to that. But in the end, we need to make what we think is the best decision and the best way for the people in Massachusetts. Yeah.
Going back to the hotel and lodging stuff, I guess just to clear it up a little bit, are you guys encouraging people to book a room for like a minimum of 2 weeks and then stay in that room for 2 weeks before they kind of set out and explore the state with this 14-day advisory to quarantine and travel in the state?
No, I mean, for the most part, the guidance we have there is consistent with the guidance that almost every other state in New England, and frankly in the Northeast, has right now. And I think part of that is just about being consistent with where everybody else has been.
Governor, have you reached out to the governor of Minnesota, and I wonder if you could share your thoughts on what's going on there?
So I don't know how anyone could watch that video and not be just outraged by it. I know I was. And And I say that as somebody who knows a lot of folks in law enforcement, and I believe in the important and critical role that law enforcement plays in keeping people safe. And one of the things I admire the most about sort of the attitude and a lot of the sort of framing around law enforcement in Massachusetts is every year we do the Hannah Awards, which are the most important and highest medal of honor you can get in law enforcement in Massachusetts. And the last couple of years, more than half the people who win those awards win them, or receive them is probably a better way to put it, because of some situation they were in where they de-escalated, they avoided trouble. They were in a tough, difficult, tense environment, and they used their training to do the things they needed to do to de-escalate the situation so that nobody got hurt. And I think I've talked to local leaders in Massachusetts about this. I've talked to our own folks about it, and have basically said that if people choose to protest, you know, we need to make sure they have the ability to do that. We hope people protest peacefully, but honestly, it's a moment like that, an event like that, I can't imagine why people wouldn't want to get out on the streets and make a point about it.
And have you reached out to the governor there?
I haven't, no.
Thanks, everybody.
Thanks, everybody.
There's a bill on your desk about nursing home data reporting. Any thoughts on that? I know they just passed yesterday.
Is it okay if I read it first? Okay. Obviously, we care a lot about reporting. We've done a lot of work to enhance our reporting here in the Commonwealth. We think it's important. Thank you.